ਹੈਲੋ ਫਰੈਂਡਸ, ਮੈਂ ਹਾਂ ਹੋਮੋਪੈਥ RS ਸੈਣੀ। ਸਾਡੇ ਹੋਮੋਪੈਥਿਕ ਜਿਹੜੇ ਟੂਲਸ ਨੇ ਦਵਾਈ ਨੂੰ ਲੱਭਣ ਦੇ ਜਾਂ ਸਿਲੈਕਟ ਕਰਨ ਦੇ, ਉਹ ਹਨ ਮਟੀਰੀਆ ਮੈਡੀਕਾ ਅਤੇ ਰੈਪਰਟਰੀ। ਰੈਪਰਟਰੀ ਇੱਕ ਇੰਡੈਕਸ ਹੈ ਸਿੰਪਟਮਸ ਦਾ, ਜਿਹਦੇ ਰਾਹੀਂ ਅਸੀਂ ਮਨੁੱਖ ਦੇ ਬੋਲੇ ਗਏ ਲਫ਼ਜ਼ਾਂ ਨੂੰ, ਮਨੁੱਖ ਦੇ ਵੱਲੋਂ ਦਿੱਤੀ ਗਈ ਆਪਣੀ ਤਕਲੀਫ ਦੀ ਹਿਸਟਰੀ ਦੇ ਵਿੱਚੋਂ ਜਿਹੜੇ ਢੁਕਵੇਂ ਪਹਿਲੂ ਨੇ, ਉਹਨਾਂ ਦੇ ਵਿੱਚੋਂ ਅਸੀਂ ਰੂਬਰਿਕਸ ਫਾਰਮ ਕਰਦੇ ਹਾਂ। ਅੱਜ ਅਸੀਂ ਇੱਕ ਰੂਬਰਿਕ ਬਾਰੇ ਗੱਲ ਕਰਾਂਗੇ ਅਤੇ ਉਹਦੀ ਡਿਟੇਲ ਦੇ ਵਿੱਚ ਸਟੱਡੀ ਕਰਾਂਗੇ। ਰੂਬਰਿਕ ਹੈ Coquettish, not enough, Coquettish too much, and Coquettish too much in children. So these are actually three rubrics: Coquettish, not enough, Coquettish too much, and Coquettish too much in children. So first of all, we will understand the meaning of the word coquettish. The literal meaning of the word coquettish is about a person who displays excessive flirtatiousness or overly playfulness or exhibits a behavior which is seductive in nature. It includes exaggeration, overdoing, too showy, too forward, and too provocative. You see in your clinics patients of various shades and various colors and various temperaments, and they present themselves in one or the other way. Every patient doesn't present himself or herself in the same manner or in the same disposition. They differ in many levels. So a person who is categorized as coquettish is the one who is too showy, too flirtatious, too open, and too much trying to become one with the other. And this has actually most of the times, coquettish word has the connotation of a seductive behavior which is inkling towards sexuality. The behavioral expressions of these people will be clearly seen in their open flirtatiousness, and that flirtatiousness, seductiveness will be excessive in nature. They try to seek attention through exaggerated charm which they present to the others, and in a clinical setup they present this charm of theirs to the physician in order to attract his attention, so that the physician will give them the good remedy, the best remedy. And they use sexuality or seduction also as an over-the-top way to seduce others or to influence others. And this behavior in many clinical setups, you will see, is a kind of inappropriate behavior or inappropriate body language of the patient. They show very dramatic and theatrical flirtatious behavior of theirs. And that behavior is not subtle, is not gentle, it is too much. The word too much will be fitted in the behavior of such people. And how do we symbolically use this trait of the person in our clinics? So this overdoing seductiveness and attention seeking through flirtatiousness and inappropriate sexual playfulness, you will observe by observations. For example, in the clinical setups, we see patients who are coming and who are just walking into the clinic, and the secretary or the attendant in the clinic or the assistant in the clinic attends to them, and before asking anything, they will immediately tell the secretary, "Oh, your nail polish, your nail paint is really in perfect match with your shoes. You're looking so beautiful. You have worn very nice clothes. this really befits your personality. So this is nothing but a seductive and over and exaggerated behavior which is uncalled for in that situation. So from there, through the behavior I have explained, if people have this behavior, then they are showing nothing but they are showing their coquettishness which is overflowing, a coquettishness which is overboard. And the rubric coquettish too much covers this trait of theirs. The remedies in this rubric there are many other remedies, but prominent amongst the other remedies are lachesis, phosphorus, pulsatilla, and belladonna. Further, each one of these remedies have their individual traits, individual mental, emotional setups. And the second rubric under the same heading, coquettish, is coquettish not enough. So these people are those who are flirtatious, who also go overboard, who also are showy, and they want to attract attention of the physician or attention of others through such kind of inappropriate or not fitting the situation behavior. They try their best to influence, they try their best to attract attention, but they are not up to that level because they have something which is a kind of shortcoming in them. They want to project themselves as flirtatious, but maybe their self-confidence is low. They are not able to come up with the proper words befitting that flirtatious nature and flirtatious behaviors of theirs. So from there, we get to know that the person wants to attract attention, wants to project himself and become showy overly, but is not able to do that. So that in this situation, a person with this kind of the personality will be categorized as coquettish not enough. And then we have such behavior from the children also. Children who have coquettish behavior will try to influence you through their charm, through the facial expressions, through coming near to you, through asking you, how are you, uncle? How are you, doctor? What are you doing? They will come and start touching your objects which are lying here and there on the table. They will ask you questions, even, what's your name, doctor? So they want to come to you. They want to just show their openness. And such children are also coquettish. And they are also categorized in this rubric, coquettish too much. From the body language, we can decipher this coquettish behavior of the patients with the body language by seeing that many patients have a tendency to sit on the chair, draw the chair near to the table of the physician, and put their both arms on the table and lean forward so as to get as much closer to the physician as possible. They show their affectionate behavior in there. They show that I am one with you. I know you for long. So they have no barriers as a matter of fact. So this is the body language which coquettishness shows us through this behavior. The remedies which are prominent, as I have already told you, the medicines are sulfur, phosphorus, lachesis, belladonna, pulsatilla in these rubrics. So whenever you see a behavior which is overflowing, which is not appropriate to the situation, which is seductive in nature and has sexual overtones in the speech of the person or in the body language of the person, categorize that person into this rubric and come up with the remedy along with adding up the other traits of the patient so that you have a proper picture in front of you, which is depending upon other mental emotional traits of the person also, and not only just on one rubric. We have just tried to explain one rubric, the coquettish enough, coquettish not enough, and coquettish enough in children. or Coquettish too much in children or too much in adults. So please always understand the language, understand the versions, understand the stress, tone, style, and speech of the patient who is sitting in front of you. Do this all with a focused mind and then come out with the proper, appropriate rubrics which will help you to come out with the single most remedy in the problem of that person, which will help him settle down on all the levels of his sickness. Thank you very much for listening. Thanks a lot.